Podcast. I am Frank McCaffrey. We are joined by ALG president, the man who I refer to as the hyper-informed one, Rick Manning. Oh, live podcasting at its very best. Uh, we are talking about a lot of things. Rick is in lockdown at his home in Chesapeake Beach, Maryland. I'm in lockdown at my home in McAllen, Texas. And, we're surviving a lot. Most people are making the best out of their time here. It's a crazy time, but we're getting by. I just wanted to bring something up real quick before we start getting into the topic. I was on Facebook, and a friend said something about how he can't go much longer without a haircut. And then I jokingly posted a picture that you'll see here. I'll put it up here. It's a pretty funny joke I had. I guess Rick could see it too. It's of Saddam Hussein after he was being dragged out of the spider hole after being captured. I believe it was in 2003 by an American soldier. And his hair was mangy, he had a long gray beard. And I said, well, this is what we're going to look like when we're done with this shelter in place. Right? Pretty funny. Not the funniest thing ever, but a good, edgy, comical act.
It was worth two chuckles on a 4-chuckle meteor.
Exactly. And that's probably the best you're going to get from me. 2 chuckles on a 4-chuckle meter. but here's what happened. Here's the
maybe
part.
2 groans.
Yeah. Here's the part that makes it outrageous. What happened was Facebook censored that. Facebook censored that picture. I'll put it up again. What are they, allies with Saddam Hussein? How do you explain the politics behind that? I mean, it makes no sense. That is not offensive. I mean, he's got blood coming out of his mouth in the picture, but I'm sorry. I've seen far worse on Facebook, and I'm assuming that if I showed the picture of Kathy Griffin holding up the severed head of Donald Trump, it would not have been censored, right? I mean, so you got to question what really goes on in the politics of America and our social media. We appear to have lost Rick here.
I'm here.
We lost your video, Rick.
You lost my video. My video is right here. I can see it. Am I still there?
Let me see. Very strange. We lost your video here.
Okay, hold on. I just clicked a button. Let's see if it comes back.
Let me. It's probably on my end. Okay, I got you. Got you back here. Okay, again, the wonderful world of live podcasting.
Because what would people do without being able to look at this mug? I mean, it's I know people tune in specifically to see the various iterations of my face.
Yeah,
but
absolutely. Yes.
So no, it says Facebook censored took down the post with a picture of that was essentially an AP picture. It was a picture that got lots of coverage. Everybody's seen it, and it's and not deemed as offensive by anybody but somebody sitting in their basement working for Facebook, looking for anything that might offend even the most genteel of senses. So that is it's, I don't know what their problem is, but we're dealing in almost a Brave New World environment where bots and other things that we don't understand, operating off of algorithms, make determinations of what's sensitive. And that way people say, oh, we didn't do that. That was the algorithm, never admitting that they wrote the algorithm. They created the biases in the algorithm. And as a result, they created essentially a PC monster on their own devices. And that's what Facebook has done.
It's very strange, very strange. I was thinking, is someone putting me on? Is what my initial reaction was. Is someone putting me on here?
You got to be kidding me. Yeah, what's wrong with this? You got to be kidding me.
Are there a lot of Saddam Hussein fans at Facebook? Okay, so now we have to move on to our scheduled topic for today, which is importing from other countries, namely China. How does it change after this COVID thing? Look at the world around you. Look how much we get from China. We get this pen I have is probably made in China. Nail clippers, boots, electronical equipment. There's just parts everywhere. Beds, everything. You name it. Everything's made in China.
Yep.
TVs, phones, again, clothing. Just it seems like so much of our world comes from China. A lot of that is, unfortunately, free forced labor. People who were deemed to be counter-revolutionary in their thinking. But we definitely we get a lot from China, and there's concern about whether or not that relationship will continue after this. There's concern about what will continue with our relationship, period, with China. How much longer we're going to be buddying up with Xi Jinping after this one. But do we import things from China after this experience, Rick?
Well, I think we'll import some things from China, but I think there'll be a lot of consumer demand that Chinese imports don't fill their shopping cart, and ultimately, Walmart makes a decision to change their supply chains out of China based upon whether people are willing to buy their stuff at Walmart that's made in China. And if they see that the made in China label is harming their brand, is harming their sales, at that point they'll move supply chains. It's one of the hardest things. This past Christmas, I attempted to not buy anything from China, and every retailer I went into, I'd find things I wanted, I liked, to buy for my wife there were Chinese apparel made in China or elsewhere, or primarily China. And I would go in, go up to the desk and I'd say, I really want to buy this, but I'm not going to because it's made in China. And quite honestly, I don't feel comfortable having slave labor making clothing for my family. And the person would look at me, the retail clerk who was getting paid a small amount of money, look at me knowingly and say, yeah, it's pretty sad, but there's nothing I can do about it. And so ultimately it takes a lot of people doing that, at which point retailers will say, if I want to sell goods, I can't have them coming from China. And that will make the difference. I think the pharmaceutical industry, we will have a thriving pharmaceutical industry, manufacturing industry here domestically within a year. I think that we're looking at a lot of changes in our overall trade relations. Ironically, the Chinese the trade deal, the phase one of the trade deal that President Trump worked with them. They're supposed to buy a lot of agriculture goods from the United States and some other things as well. And we're supposed to buy some things from them. But, by and large, we've already been buying stuff from them. And the president the trade deficit with China was huge. And actually, this past year, it dropped pretty precipitously, but still existed. We've got this. I think the world's going to change. I think China will. Chinese exports suppliers will look for other places to get stuff from rather than China, and this will have a long-term impact on the Chinese economy.
All right, now I'm looking at list of trading partners with the U.S. China is number one. This is according to Wikipedia, whether you trust them or not.
Wikipedia is wrong. Wikipedia is wrong. Okay.
The European Union ranks above that, but the question is, do you count the European Union as a country?
Well, and by the way, Mexico and Canada combined are a third of our trade. And so Mexico and Canada, through the USMCA and before that NAFTA, was fully 1/3 of the international trade that we engaged in. China was 7%. So Mexico and Canada are the two highest. China is the third. UK is the fourth. Germany was the fifth, and UK and Germany could bounce back and forth between those two. Japan was fourth, fifth, or sixth in there. So you've got but that's your South Korea bumps in there at that point. But yeah, the EU that was pre the UK leaving the EU. Yeah. So the EU dumps down a little bit from there, but China was only 7% of our trade. It was a significant part of our trade deficit, however. China was about 60% of our trade deficit, while only being about 7% of our total trade. our total trade. That's the proper term.
Yeah,
So
but again, if our relationship with China fizzles, we do lose a lot that we do import, and I guess another question is, do we have another mysterious virus hit us as a result of our relationship fizzling?
well,
There's a lot of conspiracy theorists here.
the fact is, uh, most people in America sit there and say, they don't believe that there was any attempt by China to infect us, but they do know that China failed in every way to be transparent. Because if China was transparent from the outset, from when this virus first emerged, rather than trying to cover it up and hide it, if they'd been transparent from the outset, this pandemic would never have occurred.
Probably, yes.
And that's just a fact. You could have identified the people in China who had it, and isolated and effectively starved the virus out based on that, and we would not have had this problem. Instead, China hid everything, and as a result of their hiding everything, we had thousands upon thousands upon thousands of people from Wuhan traveling to the United States, traveling to the West Coast in October, November, December. The Italians in northern Italy, the Chinese are integrated into the leather trade in northern Italy. In fact, they've taken it over. And so there were huge numbers of flights from Wuhan to northern Italy on a regular basis. And those flights brought the disease. And the Chinese ran a campaign that said actually ran ads in northern Italy, urging Italians to not be racist and to embrace the Chinese who were there. Because if they didn't embrace Chinese, and it's literally hug a Chinese person was the ad. So they actually urged people to engage in people who are Asian to come to and do that, because with a goal towards taking away the stigma of the disease. All the while, they knew the disease was being transmitted from person to person. So they not only failed to notify the world about the dangers of the disease, they actually encouraged policies, encouraged actions that, in fact, caused the disease to spread.
Yeah, and socialism tends to be throughout history a system of cover-ups, and you hear people talk about how socialism works. I've talked to many, mainly younger people, who will tell you that socialism works because look at this end result here, that the schools are good and the doctors are good. It's just look at they say the medical system is good in Cuba, and I would respond by saying, okay, but there's people living out in the streets and they're driving cars from the early 1960s in Cuba. I mean, there's also starvation,
Okay.
Lots of cover-ups.
Well, one of the things that I think is obvious, socialized medical systems are designed to fail. They're designed to create a utilitarian theory of how you treat people. They're designed to say, we're going to have government officials deciding who lives or dies based upon who we're going to allocate resources towards. In the United Kingdom, where they have socialized medicine, they literally are not allowing for the best treatment that doctors have identified for the COVID-19. They are not allowing the hydroxychloroquine to be used for any patients, because it wouldn't be fair to all the patients. So consequently, they're not making their decision was, we're not going to allow treatment with something which could save people's lives if we're not going to provide that treatment to everybody. Hence, we're going to consign ourselves to being a medieval society. That's what the UK's National Health Service has decided. It seems insane, but it is rational if you were in a world of where everything has to be equitable and fair. And as opposed to acknowledging that, things aren't equitable and fair. Life isn't equitable and fair. So you'd rather have everybody die than some people be saved, because not everybody can be provided the life-saving medicine because of availability. And that's just the absurdity of that is obvious. But that's the kind of choices that governments make. Not just communist governments, any government that has a socialized health system make every single day in terms of what's valued. They say, gee whiz, you don't need it. You're 75 years old. You don't need a knee replacement, even though your knee is putting you in a wheelchair. You don't need a wheel replacement, because based on our amortization charts, you're not going to be able to maximize the benefit of the knee, because your other body parts are going to fall apart in the next 6 years, and hence you're consigned to a wheelchair until you die, because we're not going to pay for a knee replacement for you, because it doesn't make utilitarian sense. Those are the kind of decisions they make all the time in socialized medicine. They are inhumane, but they're all based upon cost. It's the exact opposite of the description you get from the Alexandria Ocasio-Cortezes, who have little real-world experience and only know what they were told was poured into their head by professors who had bad intent.
Okay, now there is some good news. I'm reading this today. Coronavirus infection rate decreases in nearly all Spanish regions. Of course, Spain was hit very hard. Right now, The total deaths in the United States, as it stands, is 9,654, but total recovered, almost double that, about 18,000. So, the confirmed cases, 337,000. I don't want to keep saying something like, hey, this has been exaggerated. I mean, that offends a lot of people when you say that, but I actually think that to a degree it has been. I actually have a friend of mine who has coronavirus, and he said it's just like constant pressuring on your chest. He feels like he might not be able to keep breathing. But at the same time, is this being politicized? Is this are we the last of the people who are going to say that this was exaggerated for political reasons, or is that something that's being dismissed as a notion altogether?
Well, I don't know that it's been politicized for political reasons. I know everything gets politicized.
Yeah.
But let's go back to the beginning. Here's what the worst case scenarios that were, possibilities that could occur if we did absolutely nothing. The people make projections and the guesses, essentially educated guesses. And based on limited information, it was assumed that as many as 2 million Americans could die from this virus if nothing was done. I think if they'd made that projection with new information, it would have been less than that.
Yeah.
Certainly, the person who came up with that projection has now, refigured it, and it is a significantly lower number based on that, a couple 100,000. But the top projection in the latest modeling is that 500,000 people could die, and it's a pretty big spread between what's the actual predicted and what the range of possible deaths are. So let's look at what's reality. This weekend, New York State, I'm not sure if state or city, but where the hot spots in New York, I think it's New York City, had over 1,000 fewer admissions into the hospital for coronavirus, for COVID-19, than they had people who were released from the hospital who no longer need to be in the hospital for it. So the admissions versus the releases were dramatically in favor of people being released from the hospital rather than being brought into the hospital. Now, this runs counter to the expectation that we will have, because of exponential growth of cases, we're going to end up with resources being strained. In fact, in New York, they are seeing more beds available rather than fewer based over this past weekend. So if that trend continues, it means that likely New York City is over the hump, and the New York metropolitan area is over the hump in terms of the worst part of the outbreak. Why is that significant? It's significant because many of the deaths that we're seeing, that we're recording, were coming out of New York City. And so so if New York City is not going to not having as many new patients, and there's a lot of patients who are recovering and leaving the hospital system, one of the biggest predictors of increased deaths is when the hospital system is overrun. And in this case, the hospital system is not overrun, and there's adequate supplies to meet the needs of that hospital system. As a result, you can expect a lower death rate out in New York City. And that's not even counting the value of treatment with various treatments that are now available that weren't a week and a half ago. So the good news is that on the hospital end of things, the resource utilization part of it, there are more beds available today than there were on Friday in New York City.
Yeah.
And that means that the spread of the virus seems to be slowing. Now, what other things can we talk about? On Sunday, on April 5th, if the data holds up, it appears that the number of deaths in the United States from COVID-19 actually did not rise between on April 4, they were one number, April 5, they were a lower number. Now, as opposed to the exponential climb up the ladder until you get the hump, we're right here in a hump. Well, as opposed to going up, it appears it went down on April 5 pretty significantly.
Yeah.
And if that occurs again, if we get a similar number on April 6th nationwide, or only a slight rise on April 6th, what we will see is what I've talked about in the past. We will see that not only is the curve flattened in terms of deaths, but in fact, the projected deaths would be significantly fewer than what's projected right now. On Saturday, the projected deaths on the one projection that's watched by the CDC and others, the projected deaths were up near 100,000 projected deaths in the United States. The projected deaths now, if this trend continues, will be significantly lower. It's now at 81,000 after Saturday. So we'll see what it is on, after the Sunday tile it gets put into place. Point is, the president and the Surgeon General and all the CDC people have all warned that this week is going to be a terrible week in terms of lots of people losing their lives.
Yes.
Because we're still seeing the exponential increase of deaths. If we have an impact from the hydroxychloroquine, if we see that there is a treatment impact from that, we see that people are not dying as a result of that treatment, it is quite possible that we will be interdicting a lot of saving a lot of people's lives and dropping that number significantly. And that's certainly a hoped for outcome that, quite honestly, the Surgeon General, in a briefing I was on last week with him, didn't count on. So we are looking at a possible break in terms of the high expectations of the number of deaths that are going to occur in America. One day is not a trend. 2 days really aren't a trend. We won't really know until Thursday if this is really a trend that's going. But if we see that number lowered from what the projections were in terms of total deaths, and we see the actual chart, as opposed to going like this, go boom, down, and then kind of creep along like this, or slightly raised, or even going down. If we see that, then it's a game changer. And the projections and all the thinking about whether or not our economy can open up on May 1st versus June 1st change. And so it certainly should be hoped that not just from the human life perspective, but return to American way of life is only, we can project that earlier if that death rate continues to be at a relatively low level versus what they were projecting it to be. I mean, folks, the projections were we're going to have over 50,000 deaths in April from this disease. 50,000 deaths, and that's more than a year's worth of car accidents. To give you some perspective, and that's what the president was looking at. And when he said we have to expand push it back from Easter in terms of the guidance, push it back for kind of remaining in place from Easter, being relinquished on Easter, to pushing it back to the end of the month, because their projection showed 50,000 dead, even with social distancing. So let's hope that projection was wrong. Let's hope that the hydroxychloroquine works, and that the death numbers are dramatically offset, and that the hospital bed needs remain to be dramatically overstated from what the predictions were using these models. If those things remain intact, we may, it'll be truly good news. A lot of lives will be saved. And some people will say the social distancing worked. Some people will say that the innovations to treat people worked, and other people will say it was all overblown. The fact is, we don't know what would have happened in an alternative universe where the president doesn't shut down airline travel from Wuhan at the end of January. We don't know what happens in that alternative universe. And because of that, we only can deal with what actually occurred rather than what might have occurred. And we see the drop in Italy. We see the drop in Spain. They're on the back end of the curve right now. And the drops in terms of the patient loads and the deaths are dramatic. And if we start seeing that here in America sooner than expected, then that is indeed good news. And that's a long way to say I don't know what's going to happen, but there's some good news in terms of the data that's come out over the weekend.
Yeah, we don't know what's going to happen here. We don't know what the bottom is. If you talk to any investment expert, financial expert, they'll tell you the main issue here is there's just no way to know what the bottom's going to be. But there are good signs, and Plaquenil, hydroxychloroquine,
Use Plaquenil. It's easier.
Yes, Plaquenil, yes. That could end up being what solves this. I noticed that we had reports coming in that the people in New York hospitals were using Plaquenil, so maybe it was just being used by them, and they were afraid to use it on their patients. They were taking the risk themselves, and apparently it was working.
Well, Frank, there's actually a reason for that. The government allowed for a mass test. They called it a test.
Yeah.
And they allowed any healthcare worker who wanted to take it.
Yeah.
As part of this quote unquote test. And then a week later, the president said, no, everybody, you're going to be able to give it to patients too. And the FDA basically jammed it down the FDA's throat. So that's why patients are able to get it en masse. But a week before that, they allowed healthcare workers to get it en masse if they signed up for it. And yeah. I actually forwarded that information to a number of healthcare workers I knew and know, so they would have it and they could sign up for it, so they could get it and use it as a prophylactic against the disease.
So this really could be revolutionary. It could help us find out what the bottom will be, and whether or not that's going to be April 30th, or maybe a week or so before April 30th. Once we know the bottom, I think we have a better idea of how to project the recovery economically. You can never predict the future in the financial industry. You never know what's going to happen tomorrow. Of course, we all learned that because there are probably people saying, "Hey, this is a safe stock" on September 10th, 2001, and then everything changed the next day. So you can never predict the future. You don't know what's going to happen, but you can get a better idea and make a more educated guess once you you get some of the information out there. And once we figure out what the bottom of this is, it'll give us a much better idea. There's a lot of small businesses that will either go out of business or just won't be the same. There's going to be a lot of people who will be unemployed for a long time. In fact, I heard a recent projection that the unemployment's going to be high up until 2021. There's going to be a lot that really changes as a result of this. But if you look at this, it could. I don't know if you agree with the wildfire theory, Rick, which is where you have a wildfire and it destroys all the great meadows and fields, and you say, all that beautiful scenery is destroyed. But then what happens is it comes back better, and that's historically what's happened with the American economy. The American economy has been very resilient. So that's what I believe is going to happen. I think we're going to come back better.
Well, one of the challenges, I think we will eventually, but here's the challenge. Our government, we had a beautiful economy, and our government arsonists intentionally set fire to it, and they set fire to it by basically saying, we're taking away all the demand out of the economy, and we're not letting customers come to your businesses anymore, and so you are going to have to lay off people, and you're going to have to, and we created a wildfire.
Yeah.
And the question is, does the wildfire also burn down the forest? So it takes 10 to 20 years for the forest to regrow, or is the wildfire basically restricted to the meadow, where it takes it a season to grow? That's the question, and that question is only answered through length of time. If the wildfire is allowed to continue to burn through the month of May, it is highly doubtful that we will have much of Main Street left when we come back. The various malls. You think of it as going to the mall. The little stores, the little shops that are in the mall along with the anchors. Well, does Macy's still exist as an anchor store? It's hard to imagine they will. They were struggling before they were denied revenues, customers. It's hard to imagine that a lot of the smaller retailers or chains like the Gap and other things like that aren't going to be whisked aside, because clothing retailers are subject to the whim of the fashion moment, based upon preteen preferences, which are notoriously volatile. So so it's really hard to know what's going to be left. What we do know is that there's going to be a lot of empty shops, and those empty shops are not going to be paying leases to the mall owner, and the mall owner then is going to have a lot of vacancies. And a mall with a lot of vacancies has a choice. Do they downgrade their standards for who can be in the mall, or do they go ahead and just have a bunch of empty slots and hope that they can survive? Well, eventually the mall owner can't make if they're not getting leases, they can't make the payment for the money they borrowed to build the mall and to refurbish the mall. And so now the mall owner is having to renege on their payment agreements, and a commercial banker somewhere is sitting there left holding the bag. And that's ultimately the challenge. We were in a virtuous cycle, and now we really have to work hard to make sure we aren't in a vicious cycle of where one missed payment by somebody who holds a lease to the landlord, then the landlord misses his payment, and then the commercial bank that the landlord is depending upon basically is upside down, because the people they sold those leases to in packages lose a bunch of money, and as a result, we end up in a vicious cycle of capital destruction rather than capital creation. When you're in a capital destruction cycle, it's very hard to stop the wildfire. And we have to hope that we avoid that through the various SBA loans that are being offered as a way for small businesses to survive in this time.
Yeah, and we certainly hope that there's a lot of small businesses where I am here in Texas, and we certainly hope they don't go away, because they're actually really enjoyable. I know I've spent a lot of time out on stories talking to some of these small businesses. The people seem to really be loving what they do. But yeah, one gets the sense that if something happens to them for 1 week, they could be devastated. You know, if they
Yeah,
lose 2 weeks, they're probably out of business.
imagine, Frank, imagine that you plunked down $100,000. You borrowed $100,000 to open up a Chick-fil-A franchise.
Yeah.
You put 50,000 of your own money. You borrowed another 100,000. You're stretched a little thin already, and then they sit there and they say, "Oh, you can't. You're not only closed on Sunday. You're closed on Monday, Tuesday, Wednesday, Thursday, Friday, Saturday as well, except for your drive-through window." And suddenly your projected revenues are cut in half. Well, you took the loan out, you paid the franchise fee based on an expectation you're going to have X amount of revenues, and now you've got X times zero point 0.5 amount of revenues because of the change in who can come to your store and recommendations that people not go out of their own houses. You know, you still have the same bills, you still have the same fixed costs, all those things still exist. And yet you're sitting there, you have maybe a few fewer employees because you're not having to take care of the dining room. But by and large, you've got all the same costs. And you have to make cuts. And what cuts you can make? You can make some personnel cuts, but you have to decide, am I going to pay the loan late? Am I going to do what? Am I not going to pay my franchise fee? All those things are decisions you have to make. And at that point, you are you're suddenly you're running on empty nonstop, and you find yourself in a vicious cycle that is very difficult to get out of. The longer we're in this vicious cycle, the harder it is to get out, the deeper in the trough we get. And so, you know, we have to push really hard to be able to get ourselves back in, at least in areas that it makes sense for governors to allow for America to get back to work. Obviously, if it's a hot spot area, perhaps not. But in areas that aren't hot spots, there's no reason for, if New York City is a hot spot, to say to Elmira, New York, that they can't be open for business. And so that's kind of the approach that needs to be taken. And it'll be something that we're pushing for, because ultimately, if you end up with 3/4 of Main Street closed down, then the cure was dramatically worse than the disease.
Yeah, and it really could be. But I do believe we come back stronger. I really do, because there's so many factors here that work for us, and one of them is that, you know, companies will start hiring people back soon, and some of the jobs might actually be better than what people had before.
Well, that's possible. That part's possible. I think we're going to have, the jobs will be different. There'll be more telework. There'll be more of those kinds of jobs. The challenge with a lot of this for small business is, particularly retailer people who have brick and mortar, is that the unemployment insurance essentially pays people more money than they made when they were actually employed. And it was done that way. The Democrats tacked on a bunch of extra money onto unemployment insurance for the next 4 months. And that was done in spite of the fact that people like me said, wait a second, if you do that, there'll be no incentive for people to go back to work who are, they're not going to go back to work for $10 an hour, making $12 an hour, unemployed. So it's small businesses doesn't have any capital. At the very time they don't have any capital, the federal government has decided that they want to force small businesses to pay a lot more money in terms of labor costs when they bring people back to the workforce. So there may be fewer jobs. You might have left a place that had 20 people doing the job, and you might come back and you might make a little bit more money, but but only 10 people are going to be there to do that job, because that small business person still has to make a living too.
I gotta point something. My Saddam Hussein picture popped up again. Let me see if I can make some changes here. I don't know how that happened.
The Saddam Hussein picture's in rotation.
Yeah,
Let's go.
Okay, now we're back to Rick Manning. Okay.
Okay.
We'd much rather look at you than
I
Saddam
combed
Hussein.
my hair. All is well. I even shaved today. So my wife was stunned. I said, I'm going to start going back to normal and doing my normal stuff. And so I got up and did my routine of shaving and all that stuff. And, it actually feels kind of good to not be grubby. So all in all, it's one of the great stress relievers is to get into a routine and stick with it. And in this case, not bumming around where, not shaving and wearing a t-shirt all around the house and shorts. Getting dressed up for work actually has a salient positive impact, at least for me. So.
No, I always sort of like that feeling of getting ready for work and getting dressed up, looking nice. No matter, it's one of those things where, and a lot of the viewers over the years complimented my dress. I had a lot of people say that I was the best dressed guy at the stations I was at, and I was thinking, a lot of that has to do with, maybe you look terrible when you're in your home alone, or when you were an undergrad partying all the time. Maybe you looked terrible, but there's something about wanting to look good when it's game time, and I think people really catch on to that and they notice that, and it helped me a lot in my career. By the way, I'm talking, believe it or not, to a friend of mine who is he has coronavirus. I'm actually talking to him now. I said that I'm currently working at home. He said that's the best way to be, man. Avoid the grocery store. He was showing his symptoms on Facebook. He actually was he said it feels like someone's constantly pressing in his chest, and it's a nightmarish experience. And you don't know if he's gonna survive. Let's see if he's got anything else to say. He doesn't have anything else to say right now, but man, I can't imagine what that's like. And this is a young guy. This is not like a 70-year-old man. This is some guy who might even I don't even know if he's 30 yet. So it does get everybody.
I know that Dr. Birx on Friday, maybe a Saturday, really said because they believe we're heading into the peak time for this United States wide, that unless you absolutely have to, don't even go to the grocery store. Don't even go to the pharmacy. Unless you absolutely have to, don't even do that, because it's going to be the peak. They're predicting it to be the peak transmission time.
Yeah.
And because there's so many people who now have it or are infected, don't even know it, that you're bound to bump into somebody who does, and you're putting yourself at risk. So, now if you need to get, if your medicines are running out and you need to get them, that's something you have to deal with. But there's now a lot of delivery systems, and it would be wise to, rather than making that trip out to the grocery store or drugstore, picking up meds and walking through and getting a soda and getting, some other stuff that you think you might want, picking up a magazine, whatever, picking up a Cadbury egg, which is my fatal flaw. But you can do all those kinds of things, but perhaps the next 2 weeks would not be the right time. And the Cadbury eggs are going to be on super sale after Easter. So perhaps, as Deborah Birx suggested, we should refrain from even that level of going out for the next couple of weeks. And let's see if we can win this by both the social distancing and the treatments, and create a situation where far fewer people die in America, and we're able to get back to work sooner rather than later.
Yeah, I think we all kind of just want to get back into the mix. I know a lot of people are I've seen it just in friends I have, and myself, my own family. We're just kind of itching to get back out into reality and get back out into the real world and drive around and walk around and, go to where we want to go to. So hopefully that changes soon enough. Rick, we're going over time here, so it's probably time to wrap up. But I hope you guys stay safe there and are enjoying your lockdown in Maryland. We're making the best of it here in Texas. So,
well, be safe, and folks out there, please hit the subscribe button and forward. If you find this helpful, forward it on to your friends so they can subscribe as well. And with that, Frank McCaffrey, Rick Manning over on this side of the country, and Frank McCaffrey down there at the bottom part of the country. the very bottom of the country.
The
Frank
very-
is
the
at the
lowest
bottom
point,
of
yeah.
the country. He truly is. Frank is at the bottom.
I am at the
And he's
bottom.
trying to climb his way up, but he's truly at the bottom right now.
Amen.
So the farthest south you can be, not being in Hawaii, but being in the continental United States, that's where Frank finds himself sequestered right now. So we will say goodbye, and we will talk to you tomorrow.
Have a good day, everybody.